A radical technique which involves drilling an electrode into the brain of patients while they're awake is being used to treat people plagued by excruciating headaches. Deep brain stimulation is proving highly successful in helping reduce the frequency of what are known as cluster headaches. Our medical correspondent Fergus Walsh followed one patient going through the procedure at the National Hospital for Neurosurgery in London.
It'll feel a little bit like a tight hat.
Yeah.
This may look painful, but it's nothing compared to 14 years of crippling daily cluster headaches suffered by Barry Wilson. Painkillers don't help him. Some sufferers have even committed suicide.
It's like somebody gets a red-hot poker, puts it in your eye and whittles it about.
It sounds like you're being tortured.
Yes. Yes.
The head frame and an MRI scan will enable doctors to pinpoint an area deep in the brain where they want to insert an electrode. The surgeon starts to drill, and yes, Barry is awake. A local anaesthetic helps. Then, with steady hands, the surgeon inserts the electrode. There is a 1 millimetre margin of error. So how does deep brain stimulation work? The electrode is linked by a cable to a pacemaker under the skin of the chest. The pacemaker sends continuous, tiny electrical impulses which pass a small current through the brain. This blocks the damaging signals at the point where the headaches originate, rather like jamming a radio frequency.
Deep brain stimulation has been used successfully for other neurological conditions. Some patients with Parkinson's disease have found that it can control their tremors, and it's now being trialled as a treatment for depression.
And it doesn't stop there.
Other examples might include obsessive-compulsive disorder. Tourette syndrome is another type of condition that we've treated at this hospital. We are really starting to understand a little bit more about what goes wrong not only in neurological conditions but in neuropsychiatric conditions and how surgery can help.
Back home in Devon, Barry Wilson feels liberated. It's 4 months since his operation and he's had just one headache rather than the daily barrage of pain.
Brilliant. Absolutely brilliant. It's just utter relief. The weight's taken off my shoulders. It's just amazing.
Barry and his wife are now able to plan their retirement without the crippling headaches which once dominated their lives. Fergus Walsh, BBC News.